Hello everybody, welcome to my channel. Today I want us to look at liver cirrhosis, and I have an essay question and I'll try to drop some hints, so I hope you stay with me till the end. Okay, so the question there, we have part A, define liver cirrhosis. B, outline the pathophysiology of liver cirrhosis. B2, state 5 signs and symptoms of liver cirrhosis, 15%. C, discuss the management of a patient with liver cirrhosis. D, state 5 complications of liver cirrhosis. Okay, so now we'll go into the details. So liver cirrhosis, by definition, it is a chronic disease or disorder of the liver where there is inflammation and fibrosis due to excessive prolonged alcohol consumption or overuse of drugs such as paracetamol, or viral infections such as hepatitis B, C, D, and others, characterized by hepatomegaly, jaundice, and ascites. Okay, so with this definition, you should be able to get your 5 marks, because like I said in the video on how to write a definition, you need to put what type of a condition it is, okay, and then you need to state or mention the causes and at least 2 or 3 signs and symptoms relating to the condition. Okay, so this is just a by the way. I want us to look at the functions of the liver. So the functions of the liver will help you to write your complications. It will also help you to write the signs and symptoms that you might see if the liver is cirrhosed. Okay, so function number 1, bowel production. So production of bowel, then detoxification of drugs and some metabolites, storage of excess nutrients and releasing them when they are needed, synthesizing of blood plasma proteins such as albumin, globulins, and proteins required for blood clotting. Then other functions include phagocytosis, breakdown of red blood cells, those are erythrocytes in case they are worn out, inactivation of hormones, regulation of levels of amino acids, producing hemoglobin, or for the use of iron, by the use of its iron content that is in the liver stores. So when the liver stores excess iron, maybe from breakdown of red blood cells, it will store this iron, and then later when hemoglobin is needed, it will produce that iron. That's why it helps in processing of hemoglobin. Okay, then other functions, resisting infections by forming immune factors and removing bacteria from the bloodstream. This is by the help of Kupffer cells. And then clearance of bilirubin. We know bilirubin is fat soluble, so the liver tries to conjugate this bilirubin and excretes it through the urine and the feces. And then storage of vitamin A, D, E, K, and vitamin B12. Then synthesis of vitamin A, and produces heat and stores iron. Okay, so now we look at the pathophysiology. So if you look at that, I've tried to simplify it. So pathophysiology of liver cirrhosis, the first thing is exposure to injurious substance. Okay, for example, prolonged excess alcohol consumption, paracetamol use, hepatitis B, C, and D, viral infection. So if someone is exposed to these causes of hepatitis, and in a prolonged way, this causes prolonged low-grade inflammation. So you have an inflammation that is low grade, and then you have progressive scarring and destruction of the liver cells, which will also lead to the remaining liver cells being proliferated to form nodules. So you find that part of the liver is okay, then the other part maybe is scarred. So now the part which is okay tries to grow back, and then this type of growth produces what are known as hobnail appearance of the liver, where it causes like islands of residue normal tissue, okay, regenerating in the scarred tissue. Okay, so this is a diagram of how that hobnail appearance looks like. You'll find that in between those dead or scarred tissue of the liver, you have normal tissue growing, so you have that characteristic appearance. Okay, and this one is mostly seen in portal cirrhosis, nutritional cirrhosis, alcoholic cirrhosis, as well as acute cirrhosis. Then this results in liver becoming irregular and distorted in shape. Then obstruction of blood vessels occurs, causing portal hypertension and portal cystine shunting. Okay, because the liver itself, the normal tissues are not working well, so there's obstruction causing to stasis of blood. So now, what are the signs and symptoms of liver cirrhosis? Number one, hepatomegaly. So this is due to congestion and inflammation of the liver. Edema and ascites due to obstruction of the portal circulation. Vitamin deficiency due to inadequate formation of and storage of use of vitamins. Mental deterioration due to accumulation of toxins. Remember, it also helps in detoxification. So it's no longer working. You'll find that there's mental deterioration because of the toxins that are building up. Then we have jaundice due to defects in bilirubin conjugation in the liver and obstruction in the flow of bile. Then loss of libido due to testicular dysfunction, hair loss due to disturbances in protein metabolism, bleeding tendencies. Okay, remember it produces clotting factors. Now the liver is no longer working, so someone will have bleeding tendencies. Then pruritus due to deposition of bile salts in the skin as well as other toxins. So someone will have itchiness, okay, on the skin due to the toxins that are building up. Then steatorrhea due to inadequate bile production. So here we know that bile helps in emulsification of fats. So someone will have fatty stools because bile is not being produced. So this is just a diagram showing the portal circulation. Okay, so now if you look at that, we have blood vessels. We have blood vessels from the stomach, from the spleen, from the intestines, both large and small intestines, going through the liver for detoxification as well as storage of vitamins, and then they continue into the inferior vena cava to the heart. Now you find that if the liver is cirrhosed, there's shunting here, the liver is completely shattered. Okay, so there's backflow of blood to the stomach, the spleen, the large intestines, so the whole portal system is static, in other words. And then you find that because of that, fluid accumulation starts in the tissues, causing ascites. Then you have all those other signs and symptoms. Okay, then another sign and symptom, we have caput medusa. Okay, palm tree sign. Now this one comes from the word Medusa. There's a lady about who was so beautiful, and then she was turned into she had snakes, her hair was turned into snakes and all that. So that characteristic appearance, that's how it looks also in this condition. So it appears distended and engorged. So these blood vessels around the umbilical cord in the abdomen, they appear distended and engorged. Okay, this is due to backflow of blood in the abdominal veins, okay, as a result of portal hypertension. Okay, so that is the diagram there. So if you look at the diagram on the right there, you have that lady with snakes. So that's the characteristic appearance of caput medusa, the palm tree sign of liver cirrhosis. So now, what are the investigations that you're going to do? You take your history of alcoholism and maybe viral hepatitis, or maybe prolonged use of drugs such as paracetamol. Physical examination, you see some signs and symptoms, spider angiomas, maybe the caput medusa and all that. Then liver function tests, you see the albumins will be decreased, prothrombin time will be prolonged, and all those. Okay, then full blood count, enzymes gamma glutamyl transferase may be raised, blood levels HB also might be low, white blood cell levels you just check in relation to a full blood count. And then other investigations, urine tests abnormal urobilinogen levels. So the urine will look red to dark colored because of lack of urobilinogen. Then ultrasound scan, you want to see if maybe the liver is inflamed, or if it is scarred and it has shrunk. You see that on ultrasound scan, the size of the liver. Then CT scan also for more information about radioisotope liver. Okay, liver scans will give you information about the liver size and all that. Then biopsy to rule out other, maybe it could be, you might check the viral hepatitis, or maybe it's a cancer and all that. Then medical management, this one will only depend on the signs and symptoms. Mostly it also depends on the level at which this patient's liver cirrhosis has gone. If it is in the acute or early stages, it could be treated. But if it is chronic and it has gone beyond a certain period, it could not be reversible. So you just treat the signs and symptoms, of which you can give antacids, okay, such as magnesium trisilicate. You give potassium sparing diuretics to try and relieve the fluid retention and spare some proteins. Then dextrose for energy, vitamin K injections. Remember, they are bleeding. Antibiotics in case of secondary bacterial infections. You can also do paracentesis to try and remove excess fluid in the abdomen. Then corticosteroids to try and reduce any inflammation that has taken place. Okay, now in relation to the medicine management, since we are done with the medical management, here we should always remember the acronym IPROPHENEMA. This will help you with the type of headings you're going to write in the medicine management. Okay, then under this, how are you going to nurse this patient? Remember the signs and symptoms, remember the functions of the liver, remember also the structure of the liver. Okay, so this will help you a lot. For example, if you know to say the patient has got tendency to bleeding, what type of environment are you going to put that patient in? Make sure that there are no objects that will cause injury to the patient. The beddings, okay, should not have creases to prevent pressure cell formation. The environment should be quiet. Okay, fluid should be titrated, or it should be monitored, or if the patient even has ascites, you need to restrict fluid. Okay, so that's why we're saying you need to check the signs and symptoms as well as the functions of the liver. It will help you on how to write your nursing management. Okay, so that is the prophenema. Okay, now in relation to our complications, this patient with liver cirrhosis is going to have anemia. Anemia will come in because of bleeding tendencies. Okay, the patient is at increased risk of bleeding because of lack of clotting factors, so they'll easily bleed, which can complicate into anemia. And then they can also have hepatic encephalopathy. So we know that encephalopathy is to do with the brain, so this is as a result of the liver's inability to detoxify whatever is passing through it as the blood, and then causing toxic buildup. Okay, so this will lead to hepatic encephalopathy. Then the patient will also have bleeding esophageal varices. Now these varices are as a result of backflow or congestion of the liver, because the liver is cirrhosed and cannot function properly. So there will be portal vein congestion leading to bleeding in esophageal varices. Okay, Then the patient is also going to have heart failure. Okay, heart failure is because of the congestion that has taken place. The patient is also going to have hypertension related to portal congestion. This is what we're calling portal hypertension. Okay, then hemorrhage. This is just bleeding. Okay, the first complication was anemia. That's a complication of hemorrhage. So hemorrhage as well on its own is also going to be a complication because of lack of clotting factors. Okay. So our IEC on prevention of liver cirrhosis to the community: you need to advise the community to avoid alcohol consumption, excessive alcohol consumption. Then treat any underlying liver disease like hepatitis B, C, and D that can lead to complication of liver cirrhosis. Then vaccination with hepatitis B vaccine. This also can help prevent any problems to the liver. Then treat cardiac disorders. Okay, any cardiac disorder can also complicate the liver because of the inferior vena cava, which takes blood away from the liver to the heart. So if the heart has got a disorder, maybe you have for example congestive cardiac failure, this will cause backflow of blood into the inferior vena cava, which will cause liver congestion, and then that can also complicate into cirrhosis. Okay, then also avoid prolonged use of hepatotoxic drugs. So for example, the best example is paracetamol. Let it not be used in an abusive way, where whenever someone has got a headache, they run to paracetamol. So let people know in the community that we are not supposed to use hepatotoxic drugs for a long time. Thank you very much. Please subscribe and share. Okay, thank you for subscribing, and thank you for listening.